Heart attack and cardiovascular diseases are still the leading cause of death worldwide, and heart attack is a common manifestation of cardiovascular diseases. As a country, we lack knowledge to intervene in a heart attack. Our awareness and understanding of this topic is very low. In this video, this person who had a heart attack could be our spouse, our friend, or a close family member. We will acquire knowledge on how to intervene with this individual. I want to show an example of your spouse. You're at home, spouse with you around 10 p.m. Your spouse had sudden chest pain, fitting the typical definition of a heart attack discussed in the videos. If we recall, what was it? Pressure, burning, tightness in chest, can strike chin, can strike left arm, can strike back. Abdominal pain may also come with, and it takes 15 minutes. There is a chaotic situation. The individual has chest pain and an emergency has occurred. The chest pain at that time may indicate a heart attack. If the person's chest pain lasts longer than 15 minutes and is in the form of pressure, tightness, or burning, heart attack should definitely come to mind. You have these symptoms and suspect your spouse had a heart attack. Unfortunately, in such a situation, you do not have a maneuver to open a vein at home on your own. Sometimes this is said, coughing can open up the blood vessels. Coughing maneuver is a quite speculative maneuver. Coughing to open heart vessels is actually a big city myth. It can be useful to increase the pulse a little in cases where the pulse is low, accompanied by heart attack situations. Additionally, avoid wasting time by continuously coughing. The initial point to recall during a heart attack is 112, which is the emergency number 112. You must definitely call 112. Tell him how you can help your spouse here. Doors should be left open. Extend your spouse. Don't let your spouse stand up. If you're home alone, this should also be on your mind. Don't stand up when you call 112. Why are we saying this? When we arrived at the scene with 112, we see that some of the patients had cardiac arrest after a heart attack, and if the person is standing, they fall and suffer a head injury. Heart attack is different from cardiac arrest. A heart attack is artery blockage. During a heart attack, many affected are awake and conscious. Don't mix up heart attack with cardiac arrest. If the heart stops, it has stopped, consciousness is lost, the pulse has ceased. If a person has a heart attack, they're awake. If the heart hasn't stopped, the person having an attack is already conscious. But just because he's conscious, he shouldn't get up and walk around. If there's a sudden cardiac arrest, a real risk in a heart attack. In case of sudden cardiac arrest, the person falls to the ground, may suffer a head injury. While we deal with heart attacks there, while we give cancer awareness, we also face the risk of bleeding due to head trauma. If a person has had cardiovascular disease before, i.e., if they've had a heart attack before, and aspirin is among their medications, you can give them one more aspirin. But I want to expand on aspirin. You're at home, person next to you has chest pain. You can't know if it's coronary artery blockage, myocarditis, or heavy caterpillar crawling. If the person has no prior experience like this, i.e. if they have chest pain for the first time, giving them aspirin is futile. Do not give aspirin to anyone with a heavy burning sensation in their chest. If the person has had a crisis before, if there is a known heart disease, or if a heart attack is the probable diagnosis, aspirin can be given with water. Do not give water other than that. Refrain from providing water immediately during a seizure episode. In case of sudden cardiac arrest, stomach contents can come up to the mouth and go in the opposite direction, causing infection. Heart attack is different, cardiac arrest is different, but if there's sudden arrest, the situation gets more chaotic. Our main preparation is to ensure that the person does not undergo any extra burden or complication when sudden cardiac arrest occurs. That's why we don't want to stand. We don't want the person to always be given water. Don't take a heart attack patient to the bathroom and wash their face. Washing face with cold water doesn't open veins. Also, coughing maneuver usually doesn't open vein, as I mentioned before. What needs to be done is to ensure that 112 arrives at the scene quickly, without fail. Assume you're alone and a companion. On the road, the car will be pulled to the right. If the hospital is nearby, you can also take the wheel and drive it there. However, if your spouse is driving, for instance, if you can't drive, please, I beg you, do not ask your spouse to go to the hospital. Pull over to the right, wait for 112 to arrive. When there's a cardiac arrest at the wheel, a traffic accident can happen. And the size of a traffic accident can be much more serious than a heart attack. That's why we don't want someone who has had a heart attack to continue driving. If it's your friend and they're having a crisis, you can take the wheel if it's close to the hospital to quickly take them to the hospital. If ambulance takes long to arrive, but someone who had heart attack should not drive, should not continue research. After all, there's little time left to go home. The hospital shouldn't be here. Pull right. What else can we do? If a person is wearing tight clothes at the moment, we can lay them down to reduce their stress. We can unbutton your shirt, we can stretch our legs, we can open the windows for the environment to breathe comfortably, but we shouldn't walk from room to room. A person should lie down where they are, uncover themselves, open the window and ventilate the area. If possible, doors at home should be left open. In an emergency, it is crucial for 112 to be able to enter through the door. And your phone should be with you. Sometimes we encounter this. The person calls 112. Later he forgets his phone somewhere due to panic with his patient. If person can't reach phone, they may not reach scene about 112. 112 may ask for low-C confirmation from you. 112 may ask for your address. Can I ask for the house number? Please have your phone with you. Summary. Learned what to do for a heart attack in this video. You might think this at the end. In reality, there is not much we can do. Yes, as a resident of your apartment, as a friend of yours, you may even find yourself experiencing a heart attack. There's not much you can do on your own. Let me close this. It's opening a vein. We see that it's opening a vein when we give this. You are doing these. These are wrong things, and it's a complete waste of time. Every 1 hour delay in a heart attack increases the risk of death by more than 20%. We don't like delays in heart attacks. If the time after a heart attack exceeds 2 to 3 hours, and unfortunately the risk of heart failure can develop. Cardiac arrest risk increasing. Time equals muscle in heart attack. To maintain strong heart muscles and revive heart patients, person must be quickly taken to hospital for prompt medical attention. Don't get into maneuvers. If I do this, it opens the vein. Do not trust the information that if we do what you see on Instagram, the vein opens immediately. I say it as a firmness. You are doing very wrong things. Our patient is coming to us with many wrong things done. You may be causing harm to your patients rather than benefiting them. Please don't do this. Call 112 quickly. Ensure patient comes to hospital fast. Greatest kindness you can do is call emergency number 112. Goodbye.